what's the difference between a condition and an illness? Do they overlap? And where do dyslexia and autism fit when we think about that, especially in an enlightened age of DEI, diversity and inclusion? How do we look at it?
Yeah, I think that is a fantastic question. It's something that I've been thinking a lot about, that, and I think that also people in the field are thinking about, because it's, it's challenging, because we had sort of psychiatry in particular had to sort of develop over time has developed diagnoses sort of, and there are lots of reasons to have diagnoses, and diagnoses have a lot of benefits. That if you can say this is the pattern that I'm seeing in this patient, then a clinician can say, oh, in other patients with this pattern, this is what has been able to help them the most. And so that there's a benefit to that. But also, to some degree, what we see is that there's a lot of, even within putting people in the same box, right, in the same diagnosis, we find that there's often quite a bit of variability, the differences, so that you've put them in the same box, but they're actually different manifestations of what we're calling the same condition or the same illness, are very different. And on top of that, there are kind of, especially in between for what you were describing with dyslexia and autism, and also ADHD and some other kind of conditions that sort of often begin very early in life, and are kind of just reflecting a different way of the brain working. That there are differences there, but this is also not that those differences can create challenges, but they are not a lesser kind of way of the brain to work. They are a different way for the brain to work, right? And so what I think we have to also think about is, when we talk about conditions that are, like not neurotypical. So there's a kind of a language of saying, is something neurotypical or is it neurodivergent, or it's kind of just different than what we consider typical. And so I think there's a movement to sort of change how we talk about conditions and realize that, that somebody who kind of is neurodivergent, it doesn't mean that their brain is not working as, it's not like it's broken or it's not working as well. It works differently. And that leads to different strengths and different challenges. And, and what we want to do then is really kind of try to understand those differences, but that we should make sure to understand them, not in a way that stigmatizes and says, you're sick because you're different, or, and we want to fix necessarily, we want to fix you because you're different. What's important is to say, how do we understand the differences in ways that can help, people with the specific challenges that they face. And I think that's a really important direction that we need to move in